I'm Dr. Sharath, consultant plastic surgeon. My main interest is cosmetic plastic surgery. Now today I'm going to do a video on rhinoplasty, commonly asked questions, and from a patient perspective, an easy explanation to take them through this process. Rhinoplasty is a surgery done to correct the shape of the nostrils, the dorsum and the lateral walls, and any structure that is not physically a pleasant one from the patient perspective for a cosmetic point of view also. Sometimes rhinoplasty is also done for nasal obstruction, wherein the septum is deviated and in addition causes problems to the individual. Obviously, for any surgery, we need to find the right kind of surgeon, a plastic surgeon who does rhinoplasties, and if you're happy in liaising with him from a surgery perspective, from an individual point of view, take you through that surgery. If there are any medication that need to be stopped prior to the procedure, if you mention to them, then you'll be advised accordingly and appropriately. The surgery can be done through different approaches. One can be an open rhinoplasty or a closed rhinoplasty or a filler rhinoplasty. An open rhinoplasty wherein the incision or the cut mark is there on the columella, which is the part of the nostril touching from the tip to the bottom of the nose. So that region is a columella wherein a cut is made and the nose structures are approached and a repair done. Depending on the region of the repair or cartilage requirement, the surgeon might take the cartilage from within the nose or the septum of the nose and then use it for augmentation at different areas of the nose. The closed rhinoplasty entails an incision from within the nostrils. The approach is done to the region specific and then a correction is done depending on the preference. If there is a bony correction, that means the bones or lateral walls of the nose are corrected, then there might be swelling or bruising around the nose and it would take some time for it to settle. Post-surgery, depending on the area of repair, you might have nostrils which have been blocked, which might have air vents through them or might not have air vents through them, and the blockage might remain for a day or two, wherein then the nostril plugs or the blocks are removed. The external nose will have either a plaster or a sort of a splint to protect the repair which has been done, and it might remain from 1 week to 3 weeks depending on the surgeon preference. There might be some bruising on the outside of the nose or away from the nose, which will settle in a few weeks. In some areas wherein if the repair has been done, the surgeon might ask you to apply any topical ointments or preparations. You will be asked not to sneeze or blow your nose strongly, and you can be given some nasal sprays to make sure that the nasal congestion is not troubling you and is alleviated. And usually the sutures are all absorbable, but there might be some removable stitches depending on the surgeon preference. Post-surgery, for the optimum result to appear, depending on the area of the workup, it might take from 4 to 6 weeks to a few months for the final outcome to be obvious to the patient. Depending on the correction, the patient confidence is enhanced and they go about their life activities with renewed vigor. Any birth defects which have been pulling them down in their confidence levels can also be corrected. And if there is any breathing difficulty due to the nasal septal obstruction, that can also be relieved during rhinoplasty, which improves the quality of life of the individual.